Good evening and welcome to Scotland at 7 here on Broadcasting Scotland. My name's Kenny McBride and I'm joined this evening by two rather excellent guests. Firstly by Sam Payton from the Save Loch Lomond Group, one of our very regular guests. And on the other side of me, I think for the first time on Broadcasting Scotland, we have Kirsty Blackman MP, who's the MP for Aberdeen North and the SNP's Deputy Leader at Westminster. So Kirsty, how are you this evening?
I'm not bad. I've had a lovely day at home working and juggling children. It's been good.
Juggling children, like in the air?
No, I'm not quite strong enough for that.
Okay.
They're a bit big these days,
Okay.
but trying to keep them busy. We made bookmarks, so that was good fun.
Oh, excellent. And Sam, how are you today?
I'm doing great, Kenny, and how are you?
I'm just holding it together. We will start, of course, as we always do, with our coronavirus statistics update. And as of 2 p.m. today in Scotland, there had been a total of 75,570 tests concluded. Of those, 61,807 were confirmed negative and 13,763 tests were positive. Last night, there were 81 patients in intensive care, with 69 of those having tested positive. And there were a total of 1,131 people in hospital with confirmed COVID-19 and a further 48 suspected cases. This does mark an increase of 136 confirmed new cases since yesterday. The number of patients in Scotland who have died from complications caused by the coronavirus infection has sadly risen to 1,912. This number only includes those who have died in hospital having received a positive test for the virus. And the latest UK daily figures available show that 32,692 patients who tested positive for COVID-19 have sadly died from their illness, an increase of 627. This number does now refer to deaths in all settings, not just in hospitals. And the Office of National Statistics today published its weekly report on deaths across England and Wales for the week ending 1st of May. This corresponds most closely to the Scottish figures published last Wednesday by National Records of Scotland. The new figures show that while deaths overall have declined for the second consecutive week in England and Wales, number of deaths are still around 80% above the 5-year average for this time of year. 17,953 people died in that week, which is 8,012 above the 5-year average. Of these, 6,035 were classed as COVID-19 related, around around a third of the total, but only 3/4 of the excess deaths. The percentage of coronavirus-linked deaths in care homes stood at a lower level than in Scotland, but the rates of other excess mortality were notably higher, which may reflect differences in statistical methods or possibly different treatment pathways between the Scottish and English health services. Continued investigation will be required to establish the exact causes of this additional mortality that is not recorded as being directly related to the coronavirus. And in Parliament today, responding to the Chancellor's announcement of an extension to the coronavirus job retention scheme, Cabinet Secretary for the Economy, Fair Work and Culture, Fiona Hislop, said, "In our letter last week, Finance Secretary Kate Forbes and I urged the Chancellor to continue the job retention scheme beyond June. The scheme is playing an important role in maintaining employment and income, so I welcome today's announcement of an extension until the end of October. I'm particularly pleased that from August, flexibility will be introduced enabling people to return to work part-time without being penalised financially, as businesses transition out of the lockdown and adapt to new operating conditions which are likely to require the maintenance of physical distancing and other public health measures. However, more clarity is required on the details of today's announcement, in particular what employers will be asked to contribute to the costs of the scheme, how any changes will relate to guidance on safer workplaces in each of the 4 nations, how workers in isolation will be supported, and what additional support might be provided to industries such as tourism and hospitality facing specific difficulties. I will be raising these issues with the UK government in the coming days." And Scottish Green co-leader Patrick Harvey, MSP, said, "While I welcome the Chancellor's huge U-turn on furlough, backing down from suggestions that he would immediately lower the rate of these essential payments, his announcement today will create further uncertainty and anxieties. We're told that the furlough scheme will continue until October, but that the current rate is only guaranteed until July. Many workers already struggling to get by on 100% of the minimum wage, let alone the 80% they're currently receiving, now face the prospect of this level reducing further. Workers need security at a time of crisis, and the UK government's patchwork approach simply hasn't provided that. The Prime Minister claims his government is led by the science, but its actions this week have made it clearer than ever that it is happy to put economic growth before lives." And Kirsty, if I could come to you first on this. What was your reaction, the reaction of the SNP group at Westminster to this announcement from Rishi Sunak today?
So we've been pushing for some clarity on what the future of this scheme looks like, and I'm pleased that he did make an announcement to say that the furlough scheme would be extended. Unfortunately, what he announced was not as clear as it could have been. He says we won't get the full details until later this month, which, to be honest, is not soon enough. And one of the things that Alison Thewlis, our Shadow Chancellor, picked up was that there is an issue about that reduction. It's possible that employers may only be asked to contribute, the government, may only be contributing 60%, and some employers will not be able to afford to top that up. So that 80% may reduce to 60% for some people, and I'm really concerned. I think Patrick Harvey expressed it nicely there. Some people are on 0 hours contracts, they're on minimum wage already, and for them to only be getting 60% of minimum wage throughout this time doesn't seem very fair, to be honest. So we need more clarity from the Chancellor, and we will keep pushing them to try and get that clarity and to try and ensure people have got enough money to live on.
Mm-hmm. And have you had any support there from the other opposition parties?
So we didn't exactly, because of the way that Chancellor announced it, he wasn't really very upfront about how this looked. He wasn't really very upfront about whether or not there would be a reduction in the level of government support. So we're not quite sure exactly where other people will sit on this yet, because we haven't had the chance to pore over the details. But it is the case that thankfully people like the Labour Party have been pushing to try and get the scheme extended. Also to things like people who've newly started their jobs, for example, saying, actually I've got a contract of employment. I may not yet have been paid, but this is my job, and therefore my employer would like to furlough me at this point, because they still can't do that depending on the date that they got their new job. So there are still major issues with this scheme, and there's also still issues with the self-employment scheme that need to be fixed as well. Yeah.
And Sam, this furlough scheme obviously doesn't directly affect you, but what do you make of this? The noises that we've heard are, as Kirsty said, that there's going to be a reduction where the government will start paying 60%, and then businesses are somehow going to be expected to contribute 20%, despite the fact that they might yet not be allowed to open. What's your feeling about this?
It's a bit confusing, isn't it? It's not very clear and what's going to happen, and especially up here in Scotland, when a lot of the businesses, there is so many small businesses. How are small businesses going to be able to afford that? That would be my concern. My main concern is, when you were reading the story out, is there may be a lot of people then getting paid off and actually losing their jobs through the scheme rather than retaining their jobs, because small businesses are not going to be able to afford to make a contribution, especially if they're not bringing money in at the moment.
Mm-hmm. Yeah, clearly that's going to be one of the big question marks over it, is how some of those businesses will be able to afford it, given that they don't necessarily have any income. We would just remind you at home, if you want to join in the conversation here, if you've got any comments on the Chancellor's announcements or any of the other stories we're discussing tonight, you can join the conversation by following us on Twitter at BroadcastScot, and you can join the conversation with the hashtag Scotland@7. We'd love to hear from you about what you've got to say about all of this. But our next story, the UK government's COVID-19 strategy of managing and not suppressing COVID-19 will inevitably lead to the return of multiple local epidemics and further lockdown. A report prepared by an independent group of scientists chaired by the government's former chief scientific advisor has said. The report, described as a rapid response to the current situation in the UK by the independent SAGE, sets out a constructive alternative to the UK government's current strategy, noting, "We detect ambivalence in the government's strategic response, with some advisors promoting the idea of simply flattening the curve or ensuring that the NHS is not overwhelmed. We find this attitude counterproductive and potentially dangerous. Without suppression, we shall inevitably see a more rapid return of local epidemics and face the prospect of further partial or national lockdowns." The summary report from its first meeting last week, which includes 19 key recommendations for the government, is published as reports emerged that Prime Minister Boris Johnson failed to consult the current Chief Scientific Advisor and Chief Medical Officer before announcing the latest changes to the lockdown in England. Sir David King convened the committee in response to a lack of transparency about the advice the government claimed to be following from the Scientific Advisory Group for Emergencies, the official SAGE. It includes critically important recommendations that the government adopt real-time or generative models as opposed to the epidemiological models based on post-hoc data. It notes the risk of basing decisions on whether to lift lockdown on an R number based on data which it says has a 3 to 4 week time lag. At the heart of the report is a set of proposals to address the government's failure to implement a policy of testing, tracing and isolating cases. The 13-strong committee urges the government to reverse the policy decision taken on March 12th when the UK, with only 8 deaths and 459 confirmed cases, stopped testing. On March 13th, Sir Patrick Vallance said this would allow the epidemic to spread and build herd immunity. And Kirsty, we've heard a lot of criticism from all over the place about the herd immunity strategy. It does seem that the government has moved past that to some extent, but we still haven't seen a real uptick in the testing and tracing. What do you make of this advice that's come out from the Independence Age Group?
Well, I think it shows that there have been issues all the way along with the fact that the UK government are not willing to listen to scientific advice. And actually, if you really contrast that with what's happened in Scotland, so we've got the Framework for Decision Making, which is the Scottish Government's paper that it published in April and then released an update in May about how we come out of this current situation. How do we move out of the current stay-at-home message? How do we move forward out of that lockdown? Now, one of the things that it specifically says in the Scottish paper is that we need to have tracking, testing and tracing in place in order for us to be in a position where we can move forward with that, in order for us to be in a position where we can, move to the next stage. And actually, it feels to me like the UK government is moving far too quickly without ensuring that they've got this in place. They're doing a pilot on the Isle of Wight, but that is just a pilot. We haven't seen the results of that yet. We don't know where they are. And one of the things that you said that I thought was most telling was the fact that when Boris Johnson announced this, he hadn't spoken to his chief scientists on this. He hadn't spoken to them about actually what the results of what he was announcing would be. And the last thing about it is that the message has just been horrendous. He's come out with one thing, he's briefed something else in the papers, they've made U-turns. He said something about it being in the water, coronavirus, and then they've had to release a statement saying it's not in the water. So the total lack of clarity, I think, has not helped anything, as well as the UK government taking poor decisions on this.
Yeah, Sam, one of the things that this report does highlight, as Kirsty said, is the poor messaging, this confusing kind of stay alert message that we've talked about for the last couple of days. It does seem that there seems to be a great deal of confusion, more confusion than anything else coming out of Westminster, even relating to that last story where we're still not sure how the job retention scheme is going to be functioning just over a month from now. What do you make of this alternative sage advice?
Yeah, it's very interesting, and it just shows what's coming out of Westminster at the moment it is so confusing. As Kirsty says, they're reporting one thing and then something else is coming out. And even yesterday morning, I was watching Good Morning Britain, and the space of that time, there were about 2 or 3 different versions of, what was going to be happening, coming. Piers Morgan was reporting through his mobile phone. But no, it's just so confusing. Nobody knows. And I feel so sorry for the people down in England right now because they don't know whether they're coming or going. And it's dangerous. It's actually dangerous. And the fact that they're not listening to their advisors or their chief medical officer and things like that, it's just really despicable. They're just treating people with contempt at the moment. They're not willing to have those adult conversations, whereas up here in Scotland, our government is, they're asking people's opinion, they're putting out there to get people's opinion and what we should be doing, how we should move forward. There's nothing down there, absolutely nothing. They're treating people with absolute contempt.
Yeah. Yeah, and the Independent Sage report, if you are interested in it, you can just Google Independent Sage. They have a channel on YouTube where their whole meeting and their press conference are archived. It's well worth looking at. That committee includes Alison Pollock, who has been on the show several times. She was speaking again about her obsession with bringing healthcare, social care rather, back into the public sector as a big part of how this should be responded to. But We don't have time to go into any more depth on that. We will move on to our next story. And in London, a woman who worked at one of London's busiest rail stations has died after having previously been spat on by a man who said he had the coronavirus, her union has said today. Belly Mujinga, who was 47, worked in the ticket office at Victoria Station. She was on the concourse in March when a man assaulted her and a female colleague. The man coughed over them and told them he had the virus, the Transport Salaried Staffs Association said in a statement. Both women fell ill within a few days of the incident, and Mujinga, who had underlying respiratory problems, was later taken to hospital and put on a ventilator. She died on April 5th, 14 days after the assault. We are shocked and devastated at Belly's death, Manuel Cortez, the TSSA General Secretary, said in a statement. She is one of far too many frontline workers who have lost their lives to coronavirus. British Transport Police said they had launched an investigation into the incident. And Kirsty, we have talked on this show dozens of times about frontline workers, not just meaning nurses and so on, but also shop workers, public transport workers and the like, who face a lot of abuse from the public on an ordinary day. But this is really kind of quite an unusual level of nastiness, isn't it?
I saw this story earlier, and she had an 11-year-old daughter she's survived by an 11-year-old daughter, which is just absolutely heartbreaking that somebody has put her life in danger and she's ended up losing her life, and now her 11-year-old daughter is left to live with the consequences of that awful situation. We had an incident in Aberdeenshire near the beginning of this pandemic where there was a young man who was coughing on members of the public, and he was I'm not sure if the police did eventually catch him, but they were certainly saying that they were chasing him and they were dealing with it with the absolute utmost severity. But we have got folk who are out there who are doing jobs that maybe don't get a lot of respect in normal times. People who are delivering mail, people who are collecting bins, people who are cleaning hospitals. They're maybe not the people that the public would in the normal course of events look up to, but actually they have been going out there putting their lives at risk in many cases for minimum amounts of pay for this, and they're doing that in order to ensure that the rest of us can remain safe, can stay in our homes, and can have the services that we require in order to be able to keep this lockdown happening. And I just think, we all need to be incredibly thankful for that. And it's probably time for a bit of a shake-up about what all of us think is important in terms of jobs. Which are the most important jobs? Well, I think it's those ones.
Yeah. And Sam, these public sector workers, public service workers, people who have to deal with the public every day. I mean, it's a risk at the best of times just now to be dealing with large numbers of people. But this is pretty appalling, isn't it?
It's just absolutely heartbreaking. My heart goes out to her daughter and the other members of her family. It's just nobody should go to work and fear to be in danger. Nobody. It's just, words fail me as to why other human beings would even think that was acceptable to behave like that. Yeah.
I mean, spitting on people is one of the nastiest things you can do at the best of times, and this is just beyond the pale. But we move on though. An additional £50 million to help the social care sector deal with the financial implications of coronavirus has been confirmed. The funding will help address immediate challenges faced in the social care sector and support ongoing provision of social care. Health and social care partnerships across Scotland have all put in place mobilisation plans to ensure the health and social care system is as well placed as possible to address the COVID-19 pandemic. Health Secretary Jean Freeman said, "We know the social care sector is at the front line of the current pandemic, and the Scottish Government has been undertaking a detailed review of additional costs incurred by the sector. This funding is part of the Scottish Government's commitment to support resilience in social care provision and ensure that any increasing need for social care as a result of the pandemic is met. I hope this will reassure the sector that additional costs related to COVID-19 will be provided, and we will continue to work closely with COSLA and NHS boards to ensure they have the resources needed throughout this pandemic." Kirsty, I'm sure obviously you'll be welcoming this money. But the social care system generally has come under so much attention during this crisis. And as I said earlier, Alison Pollock has called for the system to be looked at much more broadly and to start thinking about bringing the whole social care and care homes back into the public sector. Is that something that the SNP supports?
I mean, in terms of moving forward from this, in terms of looking at the best way to deal with this, we're happy to look at anything that people want to bring forward on going with this. We do have a system, you're right, where care homes are not in the public sector and they haven't been for quite some time. If there are models that people suggest that we move towards, then quite happy to look at that. Looking at the announcement today in the 50 million, that is, to be clear, it's going to every local authority, it's going to every region in Scotland, and it's also not just for care home services, but also for care at home services. Sure. So for those places where the services are, sometimes provided by the councils, provided by other places, in order that people can have care in their own homes, then I think that's incredibly important. I mean, we have done reform in social care. Things are different to how they were when the SNP first came into government, with the social care partnership boards that we have. And I think that has made a positive difference and actually has helped with things like delayed discharges. But you're right, looking at this pandemic, looking at how this has been tackled and how this can be taken forward, we need to look at all of the possible solutions to make sure that we're in the best possible shape should anything like this, hopefully not, but should anything like this ever occur in the future.
Yeah, and have you heard anything from any of your colleagues down south, how the social care systems in their areas are performing?
I think there are massive concerns. We've actually got a system in Scotland where more people are getting the living wage, for example, than they are in England. So the staff are already more poorly paid down there, and struggling with a lot of the issues. And they don't have the joint boards in the way that we do. So they don't have the NHS and the social care system working together in the way that ours is. So yeah, they're coming up against those problems probably more quickly than we've come up against them. But it is the case that wherever you are in these islands, that the social care system is under a huge amount of pressure. We need to be massively grateful to those people that are putting in so many hours caring for our most elderly and our most vulnerable people. And we probably do need to look at how this works going forward too.
Yeah, absolutely. Again, that's another set of workers that are putting themselves at risk every day, doing what's already a very difficult job.
I used to work in a care home. I know exactly how demanding the job is. It is incredibly demanding, and I really appreciate the fact that they're having to go and do this. And thankfully in Scotland with the right amounts of PPE, in comparison to England, where they've struggled to get some of those PPE.
Absolutely, yeah. And SNP politicians have called for a temporary relaxation of the qualifying criteria for universal credit to allow students who are in financial difficulty as a result of the pandemic to claim during the summer months. Bob Doris MSP and Patrick Grady MP have written to the UK government asking them to allow students to access universal credit and the benefits system after a recent UK-wide survey of university and college students from low-income backgrounds found that nearly 2/3 were worried about their capacity to pay rent and bills. The Scottish Government has already put in place a £5 million package of emergency financial support to help students facing hardship as a result of the coronavirus outbreak. Bob Doris MSP said financial support from the Scottish Government is already helping thousands of students, but the fact remains that many students rely on summer employment in order to meet the cost of living. Such opportunities have almost disappeared due to the COVID-19 crisis. A temporary relaxation of the qualifying criteria for universal credit to allow students to claim during the summer months, could make a huge difference for students from the poorest backgrounds during these unprecedented and challenging times. Patrick Grady MP added, the SNP has also repeatedly called for the introduction of a universal basic income or other form of minimum income guarantee to support everyone in society through the coronavirus crisis and stop people, especially those in vulnerable and low-income groups such as students, from falling through the cracks. And Kirsty, we've talked on this show countless times about universal basic income, and it does seem that the Tory government is just set its face against it completely. Do you think Patrick Grady's call here for a change to the way universal credit operates is likely to fall on more sympathetic ears?
I think there's a possibility it might. There's a lot of the MPs in England represent a huge number of students, so they may be pushing the Chancellor to do this as well. One of the first cases that I had brought to me when this crisis kicked off and when lockdown started was from a student who said, I can't work right now and I can't claim universal credit because I'm in full-time education. I'm on a 0 hours contract. Obviously, my job has just completely stopped paying me. What do I do? And, I completely understand, having, gone to university briefly myself. I had to work during that period because I couldn't have afforded to live otherwise. Mm-hmm. And if those 0 hour jobs, or if those kind of jobs in the hospitality sector, for example, that students quite often take up are not there, then I think it makes sense for the UK government to step in and pick up this slack. I'm glad the Scottish government has done something about it, but actually taking that call on from Bob Doris and Patrick Grady would make a big difference in the absence of universal basic income, which it appears, as you say, the UK government is not very keen to pursue, almost as if it's something that would be good for people.
Yeah, I mean, Sam, we've talked almost every day about universal basic income, it seems like, but this just shows it's another group of people that get missed by all the existing kinds of support, who would clearly benefit from it if they were able to get something like a UBI.
Well, that's the thing with this pandemic. It's basically shown how bad our welfare system is and how bad we look after, our vulnerable and our students. It's just, they should be hanging their heads in shame that the fact that, there's all these people, students, are not able to claim universal credit and they can't work. They're stuck in this kind of limbo at the moment, and it's just, because they're in full-time education. And what happens when after the summer holidays, when the universities go back, are they going to be going back to university, or is it going to be carrying on their education from home? So it's just so tough for them right now, when they should be concentrating on their studies. It's just really not to be having to worry, about paying their rent and where they're buying their food from, if they can afford to buy food. And there's so many of them out there that don't have the support of families that can help them on their way. And it's diabolical. So hopefully, the UK government will be a bit more sympathetic about, the students getting universal credit. But really, as we keep saying, the simple answer is just universal basic income. It just makes life so much easier for everyone.
Yeah.
That's just, it's simple. That's the thing. It's just so simple.
Yeah.
Do you know what I mean? It's like, why do they like to make life so difficult for themselves, really?
Yeah, I mean, we have discussed this at length on the show. We've had Ronnie Cowan on several times. As I've often said, that all of us here at Broadcasting Scotland are supporters because it would benefit us directly as well. It was something that would make producing a channel like this an awful lot easier. But we will obviously keep up with that campaign as it progresses. Back in Scotland, though, properties occupied by charities can now apply for the £10,000 small business grant scheme to help with pressures caused by the pandemic. The extension of the scheme is expected to result in an additional £31 million being made available to more than 3,000 small properties occupied by charities, including day centres, workshops and halls. It will apply to properties which are in receipt of any charitable rates relief or sports relief, which are otherwise eligible for the small business bonus scheme. Finance Secretary Kate Forbes said, "Our package of business support is under constant review as we look for improvements that can be made to existing schemes or any gaps we are able to fill." It had become clear that many charities which run small premises, such as day centres and halls, had been hit hard by loss of revenue during the pandemic. This is particularly pressing for small and medium-sized charities which deliver health and social care support and are heavily reliant on income from their retail operations. In order to support these vital charities, we have therefore taken the decision to open up the small business grant scheme to allow them to apply for grants of £10,000 on the first eligible property and £7,500 on any additional eligible properties. And Kirsty, again, this highlights one of the things that we kind of forget about is that many of these small charities are operating on very small margins, very tight budgets, and yet they provide vital services around the country and on a very, very localised basis. What have you got to say about Kate Forbes' announcement today here?
I mean, we rely really heavily on third sector organisations to provide additional support for people. I've long thought that there is an issue with charitable funding, that it doesn't work very well for everybody. If they can't get a service level agreement, for example, then they begin to struggle with revenue. For those charities just now that are kind of just pretty close to the line, the fact that they're not able to run some of the services that they currently do, the fact that they're not able to run the retail business, for example, as you say, then they're not able to make that money and they're not able to keep going. So I think it makes sense. And actually, I think one of the key things that this highlights is the fact that the Scottish Government is pretty good at listening to folk. So if there are issues, if there are places where things have fallen between the gap, if folk are going to the Scottish Government and saying this continues to be an issue, then the Scottish Government is looking at that and is making those changes. It's not the case that you can, on day one, produce a full scheme that works perfectly for everybody, because it's not the case that the Scottish Government could have predicted all of the scenarios and all of the things that would happen as a result of lockdown. But the fact that Kate Forbes is willing to move and make that change, I think shows, it shows the benefits of small government. It shows the fact that a government in a small country can move flexibly, and it just builds on that case for independence, is what, in addition to everything else.
Yeah. Sam, the Scottish Government, obviously, we've talked about this before as well, this difficulty that there's been because of a kind of lag between seeing what the UK government does, finding out how much money then that means for the Scottish Government, and then looking at specific needs in Scotland. What do you make about this announcement today?
I think it's amazing. It's fantastic. Considering everything they're up against, they're doing an actual great job, and making sure this, Kirsty just turned round and said there, I was going to say Katie Forbes there, but Kirsty turned round and said there, too many Ks, they listen, and then that's the benefit of, a small country, and it just goes to show you, if that's what we could do now, what could we do, being independent? And these wee small charities are so important within the local communities, because they provide so many services which are going to be essential when we come out the other side of lockdown. I know in our area we've got a small charity who provides such amazing services, to families and right across our area, but they also indirectly support other events and smaller charities within the area, and this will benefit them hugely, and this is the thing, it's all these wee charities tend to kind of work together, they can they cohabitate, they don't, they can all tend to help each other out, which is a lovely relationship they have within the communities. So yeah, it's great news, and brilliant.
And we should as well just point out that Kate Forbes only assumed her role as Finance Secretary a few weeks before this crisis began. She has done quite a phenomenal job, hasn't she, Kirsty?
But she's always been awesome. I mean, just because she wasn't in that role before doesn't mean she wasn't awesome before. But no, she has absolutely stepped up. She had to step up on budget day, and she has, she led the negotiations in the Scottish Parliament on the budget and made sure that the budget got through. And now the amount of work that she's having to do just now is absolutely incredible. And, the whole cabinet, the whole team in Scottish Parliament, and all the civil servants as well are working incredibly hard on making sure that, that all of that feedback that we are getting, that is coming in, that's coming in MPs, it's coming in MSPs, it's coming in the Scottish Parliament and the government itself, that feedback is being listened to and those changes are being made where we can afford to do so.
Yeah. Well, we move now to a part of Europe we haven't discussed for a while, and a senior Bosnian official in charge of procuring medical equipment to combat the coronavirus outbreak was suspended today amid a criminal inquiry into the importation of ventilators for COVID-19 patients that proved defective. Farudin Solak, head of the Civil Protection Authority, the FUCZ, in the Bosnian Federation, has denied accusations of irregularities in the procurement of these Chinese ventilators. However, he has temporarily stepped down from his post pending the investigation. The case arose after the coronavirus pandemic prompted the Bosnia Croat Federation government to relax public procurement statutes to allow purchases of medical equipment through direct bargaining with suppliers rather than via public tender. A raspberry processing firm, Srebrena Malina, that had no license to import medical equipment was then recruited by FUCZ to procure 100 ventilators from China for 10.5 million Bosnian marks, around £4.75 million, for the care of COVID-19 patients. The company is owned by Fikret Hodzic, a prominent television presenter who owns Srebrena Malina and is close to the largest Bosniak party. Hodzic has denied any wrongdoing. The company received a permit for the transaction only days after 80 out of the 100 ventilators arrived, spurring allegations of irregularities and prompting the state prosecutor to open an investigation into possible corruption and fraud. The prosecutors said in an initial report yesterday the ventilators did not meet even a minimum of necessary characteristics for adequate treatment of patients, and it was not advisable to use them in intensive care units. Prosecutors also believe the price was artificially inflated. Several Bosnian import-export companies with connections to the political establishment have been under scrutiny since the coronavirus crisis began amid accusations of profiteering, as authorities scrambled to plug shortages of medical equipment. Bosnia and Herzegovina, with a population of around 4 million, has registered 2,158 cases of COVID-19 and 117 deaths related to the illness. And Kirsty, I mean, I'm not expecting you to have any great insights into the system in Bosnia, but this is something we've heard about all over the world. We heard just yesterday about a company connected to Owen Patterson getting a contract without a tender agreement. How much do you reckon the speed of action that's been needed during this crisis has led to the door to corruption being opened?
I think, it's massively concerning. I think there probably are cases around the world where mistakes have been made that are genuine errors. I think there probably are cases around the world where people have seen an opportunity to make a quick buck and have decided to do that. But I think this probably highlights the fact that actually, the outreach that the Scottish Government does, the outreach that other developed countries do to try to improve democracy in other places, to try to improve the legal systems in other places is incredibly necessary. And, I've had concerns since the very beginning about the impact of coronavirus on countries like Syria, on places where there are major, major structural difficulties, where there are civil wars or wars happening. But, this corruption issue adds another layer of major concern to the lack of treatment that some people will get just by the dint of being born in the wrong country and living in the wrong country just now. So I think it's massively concerning, and probably we need to be thinking about how can we step up and take a bit of a lead in this. How can we make sure that we are assisting countries where we can? We need to be focusing out the way as well as focusing in the way in this coronavirus crisis.
Yeah, and to Russia now. And a fire apparently started by an overloaded ventilator killed 5 COVID-19 patients in an intensive care unit in a Russian hospital today, news agencies have reported. Russia's emergency ministry confirmed the death of intensive care patients in a hospital in St. Petersburg, but did not say how many people had been killed. Ventilators are at their limit. According to preliminary data, there was an overload and the machine ignited, which caused the fire, one source told the Interfax news agency. The emergency ministry said 150 people had been evacuated from the hospital. The number of new cases of COVID-19 in Russia rose by 11,656 as of Monday, a record daily increase, bringing the official total to 221,344. Only Britain, Spain and the United States have recorded more cases so far. On Saturday, one person was killed after a fire broke out at a Moscow hospital treating patients infected with the coronavirus. And Kirsty, again, this Russia, it's not the most advanced country in the world. Some of its healthcare apparatus is a wee bit behind the times, maybe. This kind of thing is just a real tragedy, though, isn't it?
It absolutely is. It shows how massively lucky we are to have the NHS and how we need to continue to fight for it and ensure that it continues to be in the public sector so that it continues to work. But, my heart absolutely goes out to these people who have been killed once again, as a result of living in the wrong country, as a result of living in a country where they don't have adequate access to ventilators or, an adequate ability to use those ventilators properly without them going on fire. So no, it's there's so much tragedy around just now. It's really difficult to deal with it all because it's kind of too big to cope with. But individual cases like this, when you hear about it, you remember that every single person that we're talking about, these big numbers, 200,000 people having coronavirus in Russia, those numbers are individual people who are struggling, trying to get through this virus, and in some cases are dying of it. So, yeah, we need to do what we can to support folk, and we need to be thinking about folk that are in these situations.
Yeah, and Sam, I mean, these two stories, do you have any thoughts on them?
They're just absolutely heartbreaking, absolutely. And as Kirsty says, it just goes to show how lucky we are with the NHS, and it just goes to show that living in other countries, they may not have the same facilities that we have got. And yeah, this is when we really should be kind of coming together and helping each other out. And it's just heartbreaking, absolutely heartbreaking.
What do you make of the fact that the Bosnian case numbers and numbers of deaths are so low? I mean, Bosnia we don't think of as being, one of the most developed, most advanced countries in Europe, and yet the rates of death are well below what we're seeing here. What do you make of that, Sam?
It's very interesting, isn't it? We'd like to know, what are they doing that we're not doing? Did they go into lockdown quicker than we did? Did they start social distancing quicker than we did? So yeah, it'd be very interesting to find out what they're doing different from what we're doing.
Yeah.
You also don't know, in terms of recorded cases, you don't know how much testing other countries are actually doing. In terms of recorded deaths, you can pretty clearly say that person has died of coronavirus, but you don't know how many times, is it the case that they're recording that every single death of coronavirus against the death of coronavirus? I'm not trying to at all suggest that the UK government has acted well in some of this in terms of the lockdown and things, the decisions that it has taken, but you can't really compare apples with apples if you don't know whether or not you're comparing them with pears.
Yeah, that is true. There is a wide variety around Europe of different ways of counting, and we can't necessarily make an accurate comparison. It does. We do, of course, hear that the Scottish Government is consulting with other governments around the world. We hope that we can learn as much as possible from those. But speaking of learning from around the World Health Organization said today that some treatments appear to be limiting the severity or length of the COVID-19 disease, and that it was focusing on learning more about 4 or 5 of the most promising ones. The Geneva-based WHO is leading a global initiative to develop safe and effective vaccines, tests and drugs to prevent, diagnose and treat COVID-19. The illness has affected 4.19 million people around the world so far, according to a tally by the Reuters news agency. We do have some treatments that seem to be in very early studies limiting the severity or the length of the illness, but we do not have anything that can kill or stop the virus, spokeswoman Margaret Harris told the briefing, referring to the body's so-called solidarity trial of drugs against the disease. We do have potentially positive data coming out, but we need to see more data to be 100% confident that we can say this treatment over that one, she added, saying more research was needed and planned. Harris did not name the treatment. Gilead Science says its antiviral drug remdesivir has helped improve outcomes for COVID-19 patients. The WHO official sounded a note of caution around expectations for a vaccine, however, saying that coronaviruses in general are very tricky viruses that are difficult to produce vaccines against. More than 100 potential COVID-19 vaccines are being developed, including several already in clinical trials. The WHO said in April that a vaccine was likely to take at least 12 months. And Kirsty, I mean, this has got to be positive news if we are starting to see some positive results in the big solidarity trial, isn't it?
Absolutely. It's, we've heard all of these stories about how terrible things are, and, about how each individual is an individual person, not just a number. But, it's nice to hear the stories as well about the fact that the best scientists in the entire world are working on trying to make sure that we can get through this, that we can get a vaccine, that we can get drugs that will ensure that the progression of the virus in individuals that do get it is reduced and that they're less likely to see severe consequences. I was talking to my children about this, and we were talking about the fact that, it's a pretty worrying time for everybody. It's a pretty worrying time for kids who are off school and who are stuck at home and not sure when they'll get to see their friends. And I was making absolutely clear that, there are good things, there are positive ways to think about this, and we can look at the fact that people are putting in so much time, so much effort, and that there are so many incredibly clever human beings out there that are putting every hour into trying to come up with a vaccine and a treatment to ensure that we can get through this.
Yeah, and Sam, I mean, we don't often talk about the breadth of scientific research around the world or the amount of international cooperation, but this Solidarity trial in particular, it's featuring patients from several countries to provide a large enough cohort to manage a proper drug trial. It's been quite interesting, as Kirsty said, to see how many of the best scientists in the world are able to cooperate on these big trials when we really need them to, isn't it?
Yeah, it certainly is. It's absolutely amazing. And it just goes to show you, how a pandemic can bring people closer, to be kind of the cheesy line. But apart from that, it just goes to show you that scientists are working together without borders, where they are, sharing, scientific data and everything. And, anybody at all who has got a wee bit of interest in the science, there's a lot of data being shared even online. I mean, okay, not so much the clinical trials, and it's quite interesting to see them making progress. And it's the thing is, what people have got to remember, it's a fairly new virus, so it is a learning process as well. But it's so positive. I mean, in that side of it, it's very positive to see that they're working 24 hours a day, 7 days a week, trying to come up with treatments, vaccines. It's fantastic.
Yeah, yeah, and we have of course we spoke to Mirela Delabegovic at Aberdeen University, who is from Bosnia, in fact, who's doing some of the research on looking at vaccines. There's several universities in Scotland that are all participating, so it is, as I say, it's great to see all that research coming together. But on other research that's happening, the COVID-19 pandemic's effect on peace agreements and ceasefires around the world is to be captured in a series of surveys. Researchers at the University of Edinburgh are examining the consequences of the outbreak on peace processes and armed conflict in more than 20 countries across 4 continents. The study also plans to assess the reaction to the United Nations call for a global ceasefire in support of the fight against coronavirus. Researchers will interview experts involved in the peace processes, including diplomats, public servants, and those working in human rights and humanitarian aid, to see whether states of emergency or restrictions in countries have changed the dynamics of conflict and peace. They will also look at whether the pandemic has changed the behaviour of armed non-state groups, the composition of countries' governments and security forces, and the funding and international support for peace processes. The researchers are gathering data on peace processes involving Afghanistan, Bougainville and Papua New Guinea, Central African Republic, Colombia, the Democratic Republic of Congo, Ethiopia and Ogaden, Iraq, Israel and Palestine, Kenya, Kosovo, Kurdistan, Lebanon, Libya, Mali, Myanmar, Nepal, Northern Ireland, Philippines, Somalia, South Sudan, Sri Lanka, Sudan, Syria, Ukraine and Yemen. Researchers say the data will help inform policymakers and other stakeholders of possible shifts in the peace process landscape due to the current crisis and influence future peace-building decisions in the countries involved. And Kirsty, as you mentioned, places where there are in states of civil war clearly have additional challenges in facing up to the pandemic. But it does potentially offer a break in those crises, those conflicts rather, where perhaps peacemakers can step in and use the pandemic to enable a ceasefire and perhaps to begin discussions, doesn't it?
Yeah, both in places where there is a kind of active wars happening, but also in places where there are significant numbers of displaced people. Some of these folk that are refugees, or they call them displaced people nowadays, some of these folk are some of the poorest people in the entire world. I mean, they have got so little in order, expecting them to be able to fight a disease while, not having a home, not having access to water supplies, not having all of those things that you need in order to have some level of stability is really difficult. So, hopefully this research can ensure that those people who are able to push for peace, those people who are able to support organisations in reaching a peace settlement, that they have got the information that they need in order to get in there and try and, get some positive out of this situation, and make sure that those very, the poorest people in the world, genuinely, that they are given some level of protection during this crisis.
Yeah. And Kirsty, I know you have to go leave us just before the end of the show, so I will just move on to our last story now. And today marks International Nurses Day. 2020 had already been designated the year of the nurse and midwife in memory of Florence Nightingale's bicentennial. Today is her birthday and was already set to celebrate the work of nurses and midwives around the world even before the coronavirus pandemic took hold. Broadcasting Scotland would like to honour and thank nurses all over the country for their tireless work, especially in dealing with the effects of the pandemic. This applies not just to those who are actually nursing patients with COVID-19, but also the midwives, the specialist nurses in conditions like diabetes, those nursing patients with cancer and other medical and surgical issues, which of course still arise during the middle of a crisis, and the health visitors and community psychiatric nurses whose work continues but has become so much more difficult during this crisis. And Kirsty, I don't suppose I have to ask, but I'm sure you welcome this honouring of nurses around the world.
Yeah, I think, now is an absolutely appropriate time to have this. I tweeted about it earlier today. My mum, my dad, my auntie, and 3 of my grandparents were all trained nurses. And, so I'm very well aware of the level of demand that is required of people, the level of effort that they have to put into these jobs, and the level that, how much it takes out of you. I'm at a time like this, when we've got this coronavirus crisis on, you're right, not just those people that are nursing patients with coronavirus, but those that are continuing to have to provide frontline support, particularly to folk like patients with terminal cancer. I think it's an incredibly demanding job, and I think it's absolutely right that we spend the day honouring them as well as clapping on a Thursday night in order to show that we respect them and we appreciate them at this time.
Yeah, absolutely. And Kirsty, before I go to Sam, I know you've got media demands all over the place tonight, so we will let you go just now. So Kirsty Blackman, MP for Aberdeen North, SNP Westminster Deputy Leader. Kirsty, thanks so much for coming on the show. I do hope we'll be able to talk to you again soon.
Hope so. Cheerio.
Cheers now. Bye-bye.
Cheerio.
And Sam, just to come to you on that as well, I'm sure you'll be happy to congratulate and thank our nurses as well.
Oh, definitely. I don't think there's enough words out there to be able to thank them. They do a marvellous job at the best of times, never mind at the moment. They are definitely, heroes without capes, definitely.
Yeah. As Kirsty said, I think some of the other nurses, I mean, obviously those who are right on the front line of dealing with the coronavirus are maybe at the highest risk just now, but there's so much extra work goes into being, for example, a community psychiatric nurse dealing with people who are suddenly perhaps in additional isolation, who are struggling with with things like paranoia, with a virus around that tells them that actually maybe their paranoia was real. I've got a couple of people who work in that. I know a couple of people who work in that sector, and those extra challenges from the pandemic are mammoth. And people who are health visitors, midwives going to visit new mothers, all of those things, they're all adding. All of this adds so many new challenges. So as I say,
certainly does. And the thing what we forget is these people are out there doing that, and then they're coming home to their own families as well, and it's just absolutely, what they're doing is just amazing, absolutely amazing.
Yeah. I mean, some have even obviously had to isolate from their own families because they're at risk of picking up the virus.
They are making quite a lot of sacrifices at the moment. They really are. I mean, some of them here, they're not living with their own families at the moment, and it's heartbreaking, absolutely heartbreaking. But they're amazing. They're absolutely amazing people.
Yeah, we do thank all of them. So that is the end of the show for tonight. We've already thanked Kirsty Blackman. We thank her again if she's still listening. And I'd like to thank Sam as well. Always a pleasure to have her on the show. We'd like to thank you at home for joining us as well. It's always a pleasure to produce shows, but they're only worth something if we have an audience for them. So we do very much appreciate you joining us. We'd especially if you're able to support Broadcasting Scotland, though, we would very much appreciate that. Every penny you contribute helps us produce more and better shows. So if you are able to do that, please do go to broadcastingscotland.scot/register and sign up as a supporter. It's £5 a month is our typical subscriber amount. You can also contribute any amount. But any amount you can contribute makes a huge difference. And if you're not able to support us financially, again, please don't feel bad about that. The shows are designed to be free to view online. They will always remain free to view online. And you can still help us in a big way by helping get the word out about Broadcasting Scotland. We're not able to do a lot of marketing ourselves, so we do rely on you to spread the word about us. So you can follow us on Twitter at Broadcast Scot. You can just search Broadcasting Scotland on Facebook and find us there as well. And then please do share the shows around. Use our hashtag Scotland at 7 through the week, and then hashtag Full Scottish on a Sunday to let people know what's on the show, what's being talked about, and why you think it's worth watching us. And I would just say that since mid-January, almost every day since mid-January, Broadcasting Scotland has been covering the coronavirus. We spoke to Victor Rudenko. We've talked about that show on February 6th. He was just returned from China to Belarus. He was in quarantine at that time. We talked to him, and that's one of the kind of times when we realised just how serious the crisis was becoming. And I have to say that if the British government and the Scottish government had been watching Broadcasting Scotland rather than certain other broadcasters, they might have had an earlier warning about just how serious this crisis could become. I think we have. It's something I'm very proud of, is the coverage that we've done on this crisis since mid-January. So it's just one of those things to bear in mind that, just because we're small, just because we don't necessarily have the biggest audience, doesn't mean that we aren't doing good work. And as I say, that's one aspect of what we do here at Scotland at 7 that I have been particularly proud of. Obviously, that goes for the whole team here. It's not just me that makes that happen. Obviously, Linda, our producer, is the nerve centre of everything that happens here, and she deserves a great deal of credit for everything she's done. But that is all we've got time for tonight. So once again, I'd like to thank Sam very much. And again, our thanks to Kirsty Blackman for joining us. I do, as I say, hope we'll see both of you again very soon. But that's all we've got time for. I'll be back again tomorrow at 7 as usual. But until then, please do have a great evening. Good night.